Hi, my name is Daphne James, and I am presenting a DNP-led project on helping Alabama to live healthier with hypertension. The objective is to find hypertension, statistics and background data on hypertension, health risk factors, and need of project health. Targeted population of hypertension, risk factors of hypertension, describe interdisciplinary project health, and identify the involved discipline. Identify the leadership competencies necessary for the APN in developing and implementing the plan. Hypertension is known as the silent killer. Hypertension, often known as high blood pressure, is a prevalent condition that results in arterial damage within the human body. This phenomenon occurs when there is a persistent elevation in blood pressure, resulting in increased cardiac workload to facilitate blood circulation. A blood pressure greater than 120 over 80 is considered hypertension. Statistics of hypertension is the prevalence of high blood pressure in African American is 54% of the population. High blood pressure costs the United States about 131 billion yearly, averaged over 12 years. According to 2015 to 2018 data, among black adults 20 years of age and older, 58.3% of males and 57.6% of female had high blood pressure. Having hypertension puts you at risk for heart disease and stroke, which are leading cause of death in the United States. In 2021, hypertension was a primary or contributing cause of 691,095 deaths in the United States. The population that I chose is African American, 18 to 65 years old, low social economic level, low health literacy. Several risk factors can contribute to the development of hypertension. Some of these risk factors can be controlled or modified, while others are beyond our individual's control. Here are the key risk factors for hypertension. First, we'll talk about the non-modifiable risk factor, which cannot do anything about: age, family history, race, gender. The modifiable risk factor you can change, like obesity, the excessive body weight, especially when it's concentrated around the abdomen, is a significant risk factor for hypertension. Losing weight can help lower blood pressure. Unhealthy diet. A diet high in salt, saturated and trans fat, cholesterol, and low in fruit, vegetables, and whole grain can contribute to hypertension. Lack of physical activity leading a sedentary lifestyle is associated with an increase of high blood pressure. Regular physical activities help maintain a healthy blood pressure. Tobacco use, smoking, and exposure to secondary smoke can raise blood pressure and damage blood vessels. Alcohol consumption, which is excessive alcohol consumption, can lead to hypertension. While some studies suggest moderate alcohol intake may have cardiovascular benefit, heavy drinking is associated with higher blood pressure. Addressing health disparities require a multifaceted approach, such as access to health care, community engagement, policies, and collaboration. I actually put an asterisk on the one that I'm going to elaborate on and provide the health disparity solution. Access to health care, improve access to affordable and quality health care, especially in undeserved communities. Community engagement, by engaging in organizations such as churches and other local groups to spread awareness and support healthy living initiatives. Policy changes. Advocate for policy that promote health equity, including addressing social determinants of health, such as access to nutritious food and safe place for physical activity. Collaboration. Encourage collaboration between healthcare providers, community organizations, government agencies, and research to develop implement strategies to reduce hypertension disparity. According to Curley 2020, The primary prevention is the process of alternating susceptibility or reducing exposure to susceptible individuals and include general health promotion and specific measures designed to prevent disease before a person getting the disease. Secondary prevention is the early detection and prompt treatment of a disease at the earliest possible stage. Tertiary prevention is implemented during the middle or late stage of clinical disease and refer to measures that taken to alleviate disability and restore effective function. The DNP-led tertiary prevention strategies to improve access to care is Cara et al. 2018 shows that home telemonitoring for hypertension can produce reliable and accurate data and is well accepted by patients. Reham et al. 2017 identified the most common texting method. Yu et al. 2017 also found that mobile clinic may engage and trust vulnerable population by driving right into the neighborhood. Corbett et al. Indicated that telemedicine is skyrocketing due to telemedicine appointment cut costs for real estate, ancillary staff, and without rooming a patient, they can start and conclude on time, allowing more patients to be seen during the day. The DNP-led tertiary prevention strategies to improve communication skills and education. So Antonio Wasca et al. 2022 suggests physician-patient communication and patient satisfaction with therapeutic relationship may influence the course and method of treatment. Asan 2021 explained that trust help build healing relationships that lead to better health care outcomes. The DNP-led tertiary strategies to improve access to care, communication, and education. Project Helping Alabama to Live a Healthier Life with Hypertension. The purpose is interdisciplinary tertiary prevention strategy aimed at enhancing education for individuals who have received a diagnosis of hypertension, designed to create an educational-based program in Alabama community to promote lifestyle modification, medication management, and blood pressure control. The discipline who assists with developing the evidence-based program is the organizational stakeholders, DNP manager, training, and development of interdisciplinary treatment team. The Project Health and DNP competency consists of organizational and system leadership. DNP graduates possess the necessary skill and knowledge to effectively spearhead comprehensive program addressing hypertension therapy on a systemic level. This entails developing improved hypertension patient care system, creating and implementing hypertension treatment protocols inside healthcare institutions. Also, the interpersonal collaboration. To effectively manage hypertension, it is essential to work together with medical professions such as physicians, pharmacy, dietitians, and others. The DNP nurse have the ability to lead and manage interprofessional teams that provide complete treatment for patients with hypertension. This is the DNP-led educational-based interdisciplinary team and their roles. The DNP project manager will oversee and ensure that the treatment team use up-to-date information, policies, and guidelines. The primary care physician and providers will prescribe necessary medication and conduct follow-up appointments along with the labs. Registered nurse will deliver the hypertension education-based program weekly in the primary setting. RN will also collect the surveys and attendance data to report to the DNP manager on a weekly basis. RN LPN will conduct blood pressures, follow up with patient on their visit, and ensure refills. Stakeholder and organization are responsible for ensuring clients continues to educate on hypertension patient with evidence-based education and program availability. Refers to other specialists will also be warranted if needed. Educational based program intervention. The American Association Hypertension Toolkit would be used to educate the patients. The patient would be educated on learning how to take their own blood pressure reading and the numbers effectively, understand what they mean, and when to report critical blood pressure readings. They will be provided a log book to record blood pressure and any other symptoms or problems they have with their blood pressure. Here are some important tips on taking the blood pressure, just showing how to take a proper blood pressure. This is another educational sheet showing how to understand your blood pressure reading from normal to elevated to hypertension stage 1 to hypertension stage 2 to hypertension crisis. Hypertension health risks. Cardiovascular disease consists of heart attack, stroke, renal failure, vision loss. Signs and symptoms of heart attack or stroke. Heart attack symptoms. Chest discomfort. Discomfort in other areas of the upper body. Shortness of breath. Stroke symptoms. Face drooping. Arm weakness. Speak difficulties. If you're having these symptoms, you need to call 911. Lifestyle changes is one of the biggest key in educating. A healthy lifestyle is the first defense against high blood pressure. Habit that help control blood pressure includes the following: healthy diet, maintaining a healthy weight, avoiding alcohol, managing stress, limiting the caffeine. Additional tips to staying healthy with your medication is understanding the medicine, remembering medication, safety of the medication, and checking the meds. Outcome measures is the main one is the blood pressure reading. Blood pressure control. This is the most fundamental outcome measure for hypertension. It involves monitoring blood pressure levels, determining whether they are within recommended target ranges according to the American Heart Association, which is less than 130/80 for most adults. Reduction in blood pressure by measuring the reduction in systolic and diastolic blood pressure value for baseline to follow up appointments or after the initiation of treatment. The percentage of patients with controlled hypertension. The outcome measure the proportion of patients who have achieved and maintained blood pressure control with a target range. Lifestyle modification, quality of life and patient report, assessing the impact of hypertension and its treatment on patient quality of life, including physical and mental health, well-being, patient education and self-management, measure the effectiveness of patient education, self-management programs in improving patient knowledge and skills for managing hypertension. In conclusion, effective management of hypertension should prioritize achieving and sustainability of blood pressure regulation, taking into account a range of intervention of guaranteeing a holistic assessment of patient and their treatment by assisting medical professionals in making well-informed decisions regarding intervention and treatment strategies. Hypertension intervention ultimately reduce the risk of complication associated with hypertension and enhance patient outcome. Education intervention facilitate patient comprehension, knowledge, enhancing medication adherence and blood pressure. Thank you. And here is the references that you can look at and some additional